the first time experience being an optometrist. So basically, I just divide this talk into two things. First is to see what is general optometric practice in UK and how people enroll for that. This has changed substantially from what it used to be when we were registering as optometrist in the last 10 years. I think it has changed a lot. So I'm going to give a brief idea of what it's like and how the registration happens for non-EEA optometrists, which is what Indian optometrists come under, because some other schemes are there. There are many schemes, but we come under non-EEA because it's not a EEA optometry. So we will discuss that first, and then we will go into hospital optometry. So my slide is not moving.
Subash, can I just ask you a couple of questions before we actually go?
Yeah, of course.
Thank you, first of all, for agreeing to talk to us. And then, this is going to be something, like you said, when I completed optometry, I had no clue what to do next, as in, hospital, optical outlet. That was the only choices that I knew of. And then exploration, various different people, and then I went to the UK, like you said, and then, things have taken a whole different path. So what about you? How did your optometry start, and what has your sort of journey been both in India and in UK? So if you could just give us a small brief, and then
Sure.
Thank you.
I mean, I think that's a very important question to answer. In fact, I think I worked as an optometrist in Shankar Nethralaya for 3 years, and I did my master's, MPhil in optometry as well, and my specialization was in glaucoma. Normally, we wouldn't know much about optometry in those days. To understand what we do in optometry practice in India is very different from what it is in UK and other countries. So in fact, we won't even know what would be the next step, whether to go and practice in another hospital or work in a practice or go abroad and do things. So these questions will pop in for everyone. So same way, I think during that time, many of my friends were moving abroad and doing things like mostly research. So I was motivated to do research, and that's my main focus. And that's why I came here, because I was funded. And I needn't work anywhere to earn that money. They gave bursary as well. So it was easy for me to come as a research optometrist. So my research was focused on psychophysics, because in master's I was doing more of glaucoma work, which led to interest in psychophysics. So I came here as a research optometrist. So after completing my PhD, I had an opportunity to work in the Manchester Royal Eye Hospital as a research associate, a postdoctoral research associate. I worked with Professor David Henson. So again, it's more of research, but it's more clinical related research. And we were doing retrospective study of seeing how socioeconomic factors work in Manchester, and how glaucoma is influenced. And we found out that people who come late progress faster, and it's more socioeconomically challenged place. So that is something I was working on with David Henson. And you can see the building here. That's the old building where I used to work. And over a period of time, it's not easy to just stay in one place doing research, because research is more to do with you have to get funding for every 2 years to support yourself, which is not easy option. And some people do it. And some people move into university to teach and then do research. Then it's 2 jobs. My interest was more into clinical and research, which I would say not many people will select, or only few people do it. Or if they do it, they'll become head of the department and then do a little bit of research and more clinical work. So my interest is 50-50. Somehow I managed to balance both and kept going on. Like because I have to do clinical work before joining a hospital or optometry practice, I just initially registered as an optometrist. I started practicing in High Street first, and then I joined Birmingham Midlands Hospital, where the specialty is contact lens, and they do one of the best contact lens fitting in the UK. So I was working there just one day in a week, but because I was still in Manchester. And then I moved, then I gave up the work, and because it's difficult to travel, I just worked in a place called Bolton. And that is more of a district hospital, which is slightly different from tertiary care center. So the workload and how we manage is different. It's more variety than more focused on something. So finally, I joined Manchester Royal Eye Hospital. So that's my journey. And now I practice as a advanced clinical practitioner in this hospital. So initially people start as an optometrist, then they go as a specialist optometrist and advanced practitioners who do different things, which I'll come to later. And finally, some people or one or two become consultants. So that's the pathway for optometry in hospital. So the point is, first we need to focus on how we register as an optometrist in UK. And then we can discuss a little bit about hospital optometry to give a wider option what we do and give an idea of what hospital optometry is. So that's the whole idea of this talk. So shall I start, or is there anything else I can tell?
No, I'll probably, interrupt if there are any questions from the participants, but otherwise I think we'll wait for you to finish. And then
okay. I mean, you can stop me anytime, because I like that. If you have questions, it's nice to answer it rather than waiting for too long. But I mean, I'm happy to go back and answer as well. So
just as a comment, I think you've worked with some of the top guys in the field, David Henson Perimetry, contact lenses. I think at that point of time, Philip Morgan and all of them were there, weren't they, when you worked at Manchester?
Yes, David Henson, still I'm working with him, Sharanya. I think now we are doing research with some well-known people in New York.
Okay.
Professor Don Hood. And we are trying to develop something with OCT and Henson Perimetry. It's going to be a new program that will be launched for optometrists in the community to use. And I'm the PA for the research. So he keeps sending emails every day. So we'll be chatting.
Guys, what PI actually means is the principal investigator. Principal investigator is the person in charge of the entire research activities of the study that they're doing. So it takes something to be a PI. So wow, there. Okay.
I think it's a good privilege, and it's nice to talk to David Henson regularly, because he's retired. He retired in 2015, but people might know him for his instrument book, I believe. And he is more known for the perimetry in UK, because about 67% of optometrists use Henson Perimetry.
Henson
it's slightly
Perimetry.
Different
from India, where the Humphrey is far more commonly used perimeter here.
Yeah.
But
so that is the difference. I think because of that, it's very important for him to get the perimetry program, which we are using a supra threshold test and trying to find out how quickly we can detect. And collaboration with OCT related work with Don Hood, who is in US, and he's the one mainly decides how OCT is, TopCon OCT should work, and they have very many research. So we can talk about it later. I think I'll go about what optometrists should do in terms of registering in UK. The first thing is we need to understand how optometry is practiced in different countries and different levels. So this is from World Council of Optometry to say how optometry is practiced in different places. I think level 1 will be like dispensing optician. Level 2 will be doing a little bit more refraction and little bit of work with patients, and level 3 will be a little bit more diagnostics. Suppose if you go to Portugal or Spain and some of the European countries, they won't have the opportunity to put some drops in the patient's eye. So that restricts them to level 2, and they can't diagnose and do things. So if somebody is able to put drops and do it, then it becomes more diagnostic service, and they will be doing fundus examination and giving advice to patient. So that becomes 3, and there is a gray area between 3 and 4, and we work in different levels. And I work at the level of 4, which is therapeutic service. So I see patients and prescribe medicine. I mainly focus on glaucoma, but I can also do other things. So prescribing medicine changes the scenario more, because initially you will be giving glasses, and then next step is to see the fundus and say you're doing a sight test, which is what most of the optometrists in UK do. And they also get involved in a little bit of therapeutic related work, and depending on their qualification and things. And they are qualified to use dilation drops and cycloplegic refraction, those things. That makes it a little bit more competent in what they could do. So if you want to practice at level 4, I think you can go up to getting a independent practice certificate, and then you can practice you can prescribe drugs as well, and that works at different levels. So the idea is to know where you are and how to move up the ladder, and when you're moving up the ladder, what all you need to know, and how to understand that in terms of becoming an optometrist in UK. So this slide is useful for that reason. So next step is to register. How to qualify as an optometrist in UK. You need to understand, I think UK is basically a few different countries like Wales, England, Scotland, and Northern Ireland. So basically, if you want to become an optometrist, you need to find a good place where you can work, because you have to be sponsored. And especially in the main cities, it's too crowded, and many people, many optometrists will be working in that place, and the chances of getting a pre-reg position, which I'll be explaining, will be very hard. So you need to understand the geography and understand people, what they do in different parts of UK, and the culture. Everything is very different in different parts of UK. So I'll go through a few basic things. What are the steps that we need to do to become an optometrist in the UK? First step would be to do the IELTS test, because you need to show proficiency in English. I think many Indians, they are reasonably good at clearing this, because we learn English as a first language to some extent in school and everywhere. So it's not too difficult, but you still need to practice and prepare yourself for the IELTS exam. Once you do that, you can register with the General Optical Council. And basically, you have to send your transcripts, and probably you'll have an interview as well. And you can talk to people, and you have to show that you are competent and you're good to be part of pre-reg post. I mean, you have to get a pre-reg position in UK before getting a full license. So to get that, you have to have 2 years experience in India or home country. And in the interview, it's mainly about showing the skill, not in terms of knowledge. It's more about how you manage the patient, which I'll come to a bit later in another slide. So it's important to get the interview cleared. And once you clear the interview, then the referral will be to College of Optometrist. College of Optometrist will be the person who sponsors your visa. And the visa will be for 2 years. In that 2 years, you have to do a pre-registration year, which is for 1 year. When we registered many years ago, this was not an option. I feel this is a very good approach, because if you are just passing the exam and just going and practicing in the community, it's not easy, actually. You have to understand many things. And in the past, it used to be like, oh, we just register and next day you can go and practice. It's not easy, especially someone who is not in practice before. And some people used to go and be a dispensing optician or optical assistant in a practice, and they learn the culture and understand how it works, which was useful. But it's a very a thorough process now, because they give you an interview and you have to pass the level of practice you're doing, and they will also make sure that you are good enough to join as a pre-reg, because they are matching with all the optometrists who work here as a pre-reg after doing a degree here. So the level of skills they gain through their optometry is slightly higher because they are prepared for that already. And when we come from India, we have different backgrounds and different experience. So you have to try to match that and think that you are a pre-reg from this country, what will happen and how they do it. And it's quite good to think that way, because once you become a pre-reg, you are similar to any other pre-reg in this country. You have 3-stage assessment to qualify as an optometrist. That will take a year, and we'll go through that little bit. So this is the process. And finally, you get a membership in Association of Optometrists, which is the insurance body for anything you do. I think you have to have insurance. So these are the 4 main steps that you need to remember. First, registering with completing IELTS, registering with GOC, making sure you pass the interview and prepare well for that. Once you register, you become a pre-reg with College of Optometrists giving you the visa. In 2 years, you have to complete it. And I think there are restrictions in how much time you get and things. So after 2 years, if you are left with not able to complete something, it'll be a problem. So make sure that you read the web page clearly, what you need to do and limitations of getting the visa, because they won't extend the visa. So you have to think about how good and how important, what I have to focus on to finish things in a year. So this is the basic step. So what I would say is generally go to the College of Optometrists website and look into things. There are, everything you need about optometry is in this website, related to how to register, to what they do, because college is the reference for all the education and training optometrist in UK. So GOC is a person, is a group which will give license, and if something goes wrong, probably GOC will come into play, and sometimes they struck off people who don't do well for a reason, and any complaints go to GOC. But College of Optometrist is the one who give you training and education. So everything is related to registration, and everything is here in this website. So definitely go and visit this website if you want to learn more. There are more other things other than just registering. It's about education, what all you have to learn and things. I'll mention a few things a bit later. So remember this website.
Sorry, Subash, can I just interrupt? There's a question here asking what pre-registration is, pre-reg here.
Pre-registration is once you, in UK, you get a degree after 3 years. And what you do is after that, you go and register under a practice. An employer will register you as a pre-registration optometrist, which is like before registering as an optometrist, you are trained under someone. So you will be looked after by someone. Although you have a degree, you have a qualification, it doesn't mean you can go and practice. So you will be basically trained under someone to do clinical stuff and understand how optometry work in community practice. So that's the time people get exposed to various things, meeting customers or learning things. In university, you will get that opportunity like in a refined way. So you might not see regular patients that much. So you need to see someone in the community, which is real world, and you're seeing patients there. So you need some help. You can't just practice just because you have a degree. So before registering, you need to go through that. And you will be assessed the 3 steps. Like first, they will be giving you, based on your competency, you will be assessed at 3 different levels. After you finish 3 levels of competency, you will be registered as an optometrist. So which I'll be explaining a little bit in the next slide. So if it's an international pre-registration trainees, you have to again go to the college website and see what's the rule for that and how do you get the registration for GOC and everything. Everything will be there in the website. So I'm not going to go through in detail with that. And this is the General Optical Council, where initially you will be contacting to get an understanding how optometrists get the idea that they are good enough to become a pre-reg. one important thing is the interview is very important, because if you show good skill and if you can convince them, they will be allowing you to do a pre-reg. Otherwise, I've heard some countries from Africa and few countries, they ask people to do coursework. They have to go and learn contact lens in the university. They will say this is something you're not good at, or you need to improve these things. So you have to go and do coursework, which will cost more. So preparing for the interview and sending the transcript and making sure that you're good at what you do in your country is very important. So that is something you need to think more. So, I mean, when you do a pre-reg, possibly you get a logbook, and this is competency, what all you need to do, and you'll be filling these things, and it will be assessed regularly. And there will be payment that you need to remember, that you'll be paying for people who assess you and things. But once you come to this country, you have to find an employer who will take you as a pre-reg and who will be helping with all this. In the pre-reg here is where you are trying to show that you are competent in doing all these things. I would say, as an optometrist, when you are practicing in India, try to think how much of this can you learn. And you have been asked to do things for 2 years as an experience. So this could be a reference for you to think how much of this I can achieve, whether I've done this or not, and whether I need to do anything more, whether I've seen a glaucoma patient, whether I've seen a macular degeneration patient. It's not about just refraction. Next step, whether you have used the slit lamp efficiently in this patient, and whether you have seen the fundus, and all these patients, you should see the fundus, and you should be able to manage them. So I think it gives a good reference for you to practice before applying for a GOC registration, and the 2-year will be very useful in that respect, I believe. So, I mean, competency is something you need to understand. What is competency? Is it just going and learning something and just going and practice? It's something more. I think they are very particular about how people behave, how they think, how they show professional care, how they care for people, and how they explain things to people. There are various things to look into. So I thought this definition will be very helpful for understanding competency, which is what somebody should think when they are practicing, so that to know what they are doing at a level, level 3 or level 4 optometry standards. So this is the thing that people normally explain as competency. That's ability to make deliberate choice from a repertoire of behavior, from handling situation and task in simple context of professional practice. I mean, I underline this because it's more about the behavior. It's not like just the knowledge. It's about the behavior, how you tell someone what they have and how they should understand the condition and what they should do as a professional. You have to be explaining that, and using and integrating knowledge, skills, judgment, attitude, and personal values in accordance with professional role and responsibilities. So this is not just practicing optometry. It's more of a soft skill that you need to show for any patient that is examined when you're doing any competency. It's not about, okay, I've done the pressure measurement, I've done the refraction, the answer is correct. That is not sufficient. And that is where you need to practice your skills, not just as a person doing a practitioner. It's more about talking to people. And most of the people here, they'll ask questions. And normally when if I remember when I was working in India, the answer will be like, okay, you can go and talk to the consultant. But here you are the consultant, you are giving advice and you look after the patient. And if you're saying somebody is having cataract surgery, they will ask 100 questions about why I'm doing this and is it necessary? And all those questions you have to answer. So think about this as an issue that we need to develop before becoming an optometrist. So, I mean, I thought I'll give a few examples. I mean, I would say communication is the key issue here, because if suppose somebody is coming with cataract, You have to give them leaflet. You have to talk through what the surgery involves, and they'll be asking how they can have the cataract surgery, how long they have to wait, and all those questions. It won't be simple as saying, okay, you are having cataract surgery, because there will be a big waiting list in the NHS. So they have to think about all that and give more answers. I mean, suppose somebody is driving, then you have to give advice on driving as well. In this country, it's very important for them to drive. And it's like, if you say stop driving, then they will not be able to go around. They'll be limited with options. And sometimes you have to make those difficult advice saying your vision is not good enough to drive, and you have to convince them. So you have to manage patients' expectation. It's not like just telling the answer. It's more about managing patients' expectation. With all this, you have very limited time. And especially if you're working in multiples where you have like 20 minutes or 30 minutes to see a patient, you can't have too much time in telling things. You have to be very careful what you're saying. You have to communicate clearly and make sure they understand and they benefit by that. And people appreciate it when things are going very well. They appreciate it, and you'll be getting feedback as well. Some people write saying thanks for referring and all those things. So it's good to know. I think for any condition, I think the amount of effort you need to put to prepare and explain, I think it's you have to plan that. And probably you have to start doing it when you're in India, because that gives a practice, good practice. And remember to say thank you, please, and how are you? These questions should be very common, and how you try to interact with them is very important. And the other thing is you also get helps from optometry colleagues. Like if you're practicing and if you don't have the ability to answer some of the questions, you shouldn't be worried about it. You just generally refer. If it's something to do with glaucoma, people refer to another optometrist before referring to hospital. So things are little bit flexible in how amount of knowledge you have. And sometimes if you don't know, you can always bring the patient back and ask someone else, senior or someone else, to see them. As a pre-reg, you will be always given an opportunity by the employer. Some optometrist, trained optometrist will be there to help you. So I think it covers many things. It's just more about the communication, how you try to explain that to patient. That should start from a little bit earlier rather than coming and starting it here. So I would emphasize on that. So, I mean, I thought these are the points I would think if I come to UK. I mean, if I'm thinking of, okay, I need to register as an optometrist here, what will I do? First thing is money. How much money I have to calculate, because you have to think about how much it will cost for registering with GOC. First, you have to do IEL test, how much it will cost. Then GOC, I think it cost around 50,000 rupees approximately, because they charge for doing the assessing the transcript or giving the interview, everything is charged. So that is second step. When you register with the College of Optometrists, to find a pre-reg is your responsibility, but for sponsoring visa and things, they charge money. And throughout the pre-reg, you'll be assessed by different people for a different stage of your pre-reg. One thing good would be if the employer is interested taking you as a pre-reg, you might be supported by the employer. Whoever it is, you can ask them whether you will get money for that and support towards pre-registration time, because you are basically an employed person there, but you are as a pre-reg, you will be given support. So employer will pay you some money as an employer, like it won't be a lot of money, but some money to be a living expense and things. And you can also ask for, say you have to move to UK and things, you can ask them, and if they are willing to, then they will also give you an interview and select you. So that is something you have to think. Money is important. Suppose if you don't get a pre-reg and things, you have to think what all you need to prepare, because without a pre-reg, you can't register. So sometimes you have to select the place which is not in a city where the pre-reg is very difficult to get. So you have to move a little bit south in the country. But there are many opportunities. I mean, from what I heard from my colleagues who work in different parts of UK, I think there is demand for optometry, so which is a welcoming thing. So up to getting a pre-reg position is a challenge, and the next challenge is to register. That 1 year, I think you are supported well. So if you have the will and focus, that shouldn't be too much of a trouble, because you are going through a process which you already know. I think you are developing more soft skills, but you are in a position to learn that in a year. And it's not like just taking the exam and passing. So you are being given support every day. So that will be quite not so difficult, but you have to prepare for it. And I would consider age as an important factor. Suppose if you're 24 and you're thinking about doing this, it might take few years, and it's important time of the your life where you might be getting married, or it depends on your family and various things. So you have to consider age as a factor, whether you want to do a degree or additional degree after that, what you're going to do. All this come in terms of age. You have to understand that and plan things accordingly. Health is an important thing, because people, when they come here, they don't realize how cold it is and how it is, and some people might not feel comfortable. And you have to learn to live, and that is something, if you're healthy, that's a bonus. I think sometimes people, when they're not healthy, it delays various things, and you have to be very, we have to make sure that you're having good health. And family support is also important, because in the first few years, maybe you need some extra money, and whether the family can support, whether it's good enough for you to do that. And you'll be missing your family, and you'll be traveling. And it won't be too hard if you get a good pre-reg post, and you'll be able to get support for yourself from the employer. But still, it's important to think what responsibilities you have at home, whether you have to get married at some age, or what other options you have if you're already married, and you have to think about children and various things. So it's important to think about family as well. And I would say knowledge in optometry is important. Like you should start a bit earlier. I wouldn't say coming here and doing a pre-reg will give you all the required things, because people who get trained for 3 years are prepared for that. And some of them don't get pre-reg position if they don't get good marks. Excuse me. So it's important to be able to convince in the interview that you are good and knowledgeable. And you can say what level of optometry you're practicing and what all you have tried and things like that, which will help the person who is giving you an interview to feel comfortable. And basically, you have to show a standard that is more like being an UK optometrist, and say that you have done this, have extra skills, and I have looked after patients, and I've done things which is benefiting patient, and patient has given some feedback, good feedback about you, and you're a person who employed you in India, they were willing to do it, and how motivated you are to do optometry. All those things matters a lot, because in the past they won't have interview, and we didn't have that challenge, but now it's important. And personality and culture is important. Sometimes it's very hard to understand what people are saying, and you have to come across easy and approachable. And the culture you show is very important, because it's not easy to adapt. Suppose if you're working in one part of UK where the culture is very different and the language is difficult, you should be a little bit polite and kind, and you should talk more. I think people like when they talk politely and they try to help. That kind of tendency will help. And you should show who you are, and that question will come regularly, because you have to tell yourself what you are trying to be. Just as an optometrist, what are the personality you bring in? I think because it's more about soft skills, so you have to think about your personality and the culture, and answer how you answer people. Some of the things will come slowly, but I think that need to be learned quickly, so that you feel comfortable. Even the examiners, sometimes the knowledge doesn't matter. I mean, you might not know what's the decay value of a particular contact lens, but you need to know how to tell that to patient in a comfortable way. You don't need to explain very technical terms. And the examiners will like how you convince patient, because That's the main thing that they are trying to see. And if you can convince them with the knowledge you have, with a little bit of good communication skill, that will be very useful. And it's helpful to be business minded as well, because once you are in, I mean, there is no direct entry to hospital. I can't think of somebody coming and registering and becoming a hospital optometrist. Normally, it will be a multiple where people register, and the employer will be willing to support as a pre-reg in multiples. Like multiples is like Specsavers or Boots. These are multiple opticians, I mean, optometry practices across the UK. So you have to see where it's available and find a place, a pre-reg place there. So if when you start, probably if you have a little bit business-minded attitude, they like it, because by the end of the day, they have to sell glasses. And that bit should come with soft skills and show how good you are. And that is more important. And basically, the communication skill, again, is the key to success in wherever you do pre-reg or any interview. That aspect of it is important. I think I would recommend Saranya to include a separate chapter in optometry, like in the third year or something. If they are trying to practice a little bit more communication, probably it'll make a big difference for them.
Taken into account. We'll work on it.
Sure, Saranya. I think I would like to mention this. It's important to understand how important the communication skill is and how a person can go wrong. I mean, I took this sentence from Spider-Man: with great power comes great responsibility. When you're responsible, you have to act like that. And that's why I explained what is the competency and what people are expected out of a person. And unfortunately, one of the optometrists, actually she's from India, ended up, she missed a case with optic disc swelling. And she didn't do the examination, and patient reported headache and things. And finally, she was struck off from the register, and it was in the newspaper. It was in the newspaper as a main headline, and it was in the news everywhere. And you have to understand that it's about communication, about telling and making sure you do the right thing. So this is an example where I would say it's important to make sure that you do extra work to care for people, and you have to manage time. Although you are getting a pre-reg opportunity and learn everything, and this case changes the scenario, how optometrists think what they are. And it's an interesting article to read as well. So think about that. I think if you make mistakes, sometimes it might be very serious. And because you can tell things and you are doing a sight test and telling people how good they are in terms of sight and what they need to do, it becomes more responsibility that you're taking when you register in this country, because there is law for everything, what you do, and people can challenge it. That's why you need indemnity insurance. But this is a rare case, and there is more opportunity. So you shouldn't put things off just because of this. But that's something to think about, and prepare yourself and be strong and bold in what you're doing, and start talking sensibly, and the behavior and communication skill, all that comes into play in that. So I thought I'll give you some useful links, because when you're in India, it might be hard for you to know what is that you need to read. And sometimes it might be you won't be getting the books or every opportunity to be in a library here or anything. So these websites give you some good understanding. Like AOP is Association of Optometrists, and there is a Optometry Today journal, and people read that regularly. And in that journal, it's not just article, it's about what's happening in optometry practice across UK. So once you think that you want to be registered optometrist in UK, I think this website will be very useful, because you can go through it regularly. I think it's a monthly publications come, and you have to have the knowledge what's happening in UK. And college website is very helpful as well. And there's a magazine which is Acchutha, which also tells more about risk factors and understanding about what's happening in optometry and what all the new things that's happening. It comes in Acchutha, and it gives research answers as well. It's not about research publication. It's more about telling what is the statistics, what are the risk factors for certain conditions, and what they found recently. There is another magazine which is Optician, which people read regularly, and that is very useful as well because it tells the story for a community optometrist to understand what's happening in their world. And it's important to read and understand because it's not something you can gain quickly. And it also gives you an idea what you need to prepare. And when you go for the GOC interview or pre-reg, I think if you're already into this, which is a good thing. So suppose if you're interested in learning how the procedures and what people follow, I think David Elliott's book on primary eye care will be very helpful. I think that's the book I read, or most of the optometrists read. It gives stepwise answers for how to do refraction and how to do binocular balancing, how to do duochrome and all those things. I think it's like spoon feeding. You get every step what they do. Probably if you already have that knowledge to practice and understand a little bit more, I think that book is very helpful. If you want to learn about ocular disease and how people manage ocular disease, I think this is the website. It's under College of Optometry. It's clinical management guidelines. And if somebody has blepharitis, what do you do and what treatment they get? Everything is there. And that is quite a good thing to read. People normally read this when they are in a pre-reg and trying to learn things, but I would say learn that before, because you can refer that and say, this is something I practice already. So I'm just saying you should be well prepared and already have the knowledge when you come here, and your pre-reg year will be a bit more smoother. And you will be learning more soft skills and other skills, how local optometry things function. And those things take time, and you don't want to be lost in learning basics. I think you probably might see many ocular conditions if you work in a hospital, but this is slightly different because you are learning to be an optometrist in UK. So these are the main things. This is good enough, I would say, for most of them who want to come here, because you get a better idea what is happening in the optometry field, what is happening in the college, what they are saying. Sometimes they might give guidelines and they say this thing is happening like this. So you have to be aware what's happening in UK. So this is a very good website and link that I would recommend for people. So the next thing is moving from community optometry to hospital optometry. I think the way it works is slightly different in hospital optometry, and I seem to enjoy hospital optometry more than community optometry because I've been in hospital in India, and when I came here, I quickly started working in hospital, and my research can be done more in hospital optometry related work. So I chose to do hospital optometry work, and there are various things that we do in optometry, in hospital optometry. Once people get registered and working in the multiples, and if they have some experience, normally they stay in the community. And if they feel that the interest is more about working in hospital, the challenge is the money is more in community. So people would be considering community as the main thing, and they don't like coming to hospital that quickly. And the advantage is in hospital, you don't have weekends to work. I mean, I don't work on weekends, and that gives a much more comfortable life. And you work 9 to 5, which is also a comfort. And sometimes I work from home. So that is what I want to do. And I selected hospital optometry. But some people might be interested in hospital optometry for the reason that the challenges they would like to face, and not just selling glasses, or if you are not business minded, and if you are more a person who is more interested in hospital work, then they have to think about hospital optometry. So I would like to explain what we do in hospital optometry. So basically, there is a link between hospital and community optometrist. And most of it could be understood by going to website, which is LOC, Local Optical Council, who bridge between hospital and the community, because some of the service is based on how locally they work. And in Manchester, we have different services. And if a patient is referred to hospital, how should that happen and what procedures they should follow? And the community optometrist will get involved in it. And some people do a little bit more work than what others do because they have special interest in optometry, like special conditions. So if you want to know about a particular place, how this works, the local optical council will be a good place to start. I think Greater Manchester Local Optical Council is what I've shown in this slide. And you can go through and see what they do, because all the information about what they do and when to refer, how to refer, all these details will be there. And if you understand, there will be a consortium and people will be discussing about what is the right referral and for different conditions and how we manage, whether the patient should be managed in the community or in hospital. These things happen by discussing with the local optical council and hospital optometry. So if you see Manchester, there are about 10 boroughs. Each borough has their own limitations. Some will have a super specialty hospital and some will be district hospital. Some people don't have hospital at all. So the referral patterns will change and they all have their own way of doing it. So in the website, there are different referrals, what all, I mean, there's a list here. And if you go to the website, you can understand how the referrals happen in each place and what they need to do will be explained there. So basically a community referral, a person who thinks there is a problem, who can't be managed in the community, will refer the person to the patient to the optometrist in the hospital, not ophthalmologist. They refer to ophthalmologist, but it's normally seen by a optometrist in the hospital. So I mentioned here as a possible diagnosis, because sometime when you start after pre-reg as a say a new person doing referrals without any help, sometimes you might be wrong and people don't worry about it. And normally what happens is, like, first 10 cases, they will be referring and they will understand that's a wrong referral or something. And slowly they'll get adapted to it and they'll get feedback from the hospital. And depending on where they work and how the referral happens, people need to learn quickly. And all these different conditions are managed in hospital by an optometrist, as long as it's within their limits. And if they need to be seen by an ophthalmologist, their condition should be a little bit more complex. So you can see here that optometrists, community optometrists manage patient, and when they can't find an answer, or if the patient needs treatment, they refer to optometrist in hospital. And there are many new roles what optometrists do in the hospital. For suppose in glaucoma, we have a Olga clinic, optometry-led glaucoma assessment clinic, where all the patients will be seen first, because we don't want to waste consultants' time, or the patient shouldn't be waiting for too long. So it will be someone who will be an optometrist qualified to see a patient who has glaucoma, will be seeing them first. For that, you need to get IP registration, independent prescribing, because if you want to prescribe drugs for that patient, you will be registering for that. And you also have a special diploma, which I have, to see those glaucoma patients. Once I see the patient and monitor and give drops and things, I don't refer to the consultants. The consultants mainly do surgery, and they look after complex cases when it comes to it. And if they need multiple treatment, they see those patients. In fact, some of the junior doctors training in the hospital will try to come and work in the optometry clinic where we see a glaucoma patient, because they don't get to see the early referrals and management. The condition is not like early glaucoma. Even in advanced glaucoma come to our clinic. because they don't need more management, we manage them. So in that way, we look after about 80% of the, I would say 60 to 80% of the patients in different clinics are managed by optometrists mainly. And same way, likewise, the macula clinic and cornea clinic, they also have optometrists who will try to manage stable patients. And the responsibility will be clearly defined, and only if it's required, they will go to the ophthalmologist. So these roles are quite new to some extent. Cornea, they didn't have optometry-led cornea clinic was not there in the past, but now in the last 3 years, just before COVID, they started. And they have a role, and that helps NHS to manage patients. So glaucoma referral refinement scheme is a scheme where optometrists refer to hospital. In the past, it used to be all the optometrists, they have to refer the patient to the GP, general practitioner. And the general practitioner will say, okay, fine, I'll refer to hospital. And that was not very helpful because we know more about eyes than a general practitioner. And the first place where we tried to break that path is in Manchester. And we started that, and we ended up developing it further as GERS optometrists. GERS optometrists are specially trained optometrists in glaucoma who probably have some qualification, but who won't manage patient. But they will check the patient before sending them to hospital. Suppose if a patient has pressure of 25 and you think there is no glaucoma, it's looking like ocular hypertension, then the person, the optometrist, if they are not GERS registered, then they will refer to a GERS registered optometrist. And by this, about 40% of the glaucoma patients can be managed in the, not referred to the hospital because they don't need, it's just, oh, something is wrong, but actually when a trained person is tested, then it becomes easier for referring the right person to the hospital. So less false positive, and economically it's better, and more time for hospital concentrate on people with glaucoma. That's a scheme which is quite useful. And there are different schemes. So I'm just trying to specifically explain glaucoma because I work in glaucoma, and it's a little bit wider scheme than other conditions, because glaucoma, you see patients regularly. And in other clinics, sometimes you just discharge them. So anything that is chronic and you look after patient will be divided into several steps, like optometrist will be involved in it, the nurses will be involved in it, and they all have a role. And when the patient goes to a consultant, it will be a role they play. And so we are all dependent on each other. Like the consultant is dependent on us for managing those patients. If I send those patients unnecessary to them, then they will have a difficulty in managing them. So that's the system we are in UK. So this is one example to show how glaucoma work in glaucoma referral happens. The community optometrist who first see the patient will decide, okay, this person looks like he has glaucoma, and refer to glaucoma referral refinement scheme. And the person who is examining next will be repeating the Fields test, measuring the corneal thickness, checks the pressure with Goldman. In community optometry, some people don't use Goldman, they use eye care or any optometry. So the idea of getting more reliable, better results will be done by glaucoma referral refinement scheme optometrist. And then they refer to glaucoma optometrist in the hospital. And in that, we have different options. Suppose if the patient is having mild glaucoma, not too complex, then we send to virtual clinic. And this virtual clinic is run by many technicians. We call them ophthalmic science practitioners. And they have the capacity to do visual field. They measure pressure, and they take OCT picture. And they take a very brief history as well. And then the patient goes home and the report comes to me. And I manage this to some extent because I'm supposed to improve the quality and benefit of this clinic. So my focus will be on that virtual clinic. And once the patient is seen in this clinic, they won't come to us. So we are eliminating those people to be seen in virtual clinic. And There are laser clinics. Some of my colleagues work in laser clinic like SLT treatment or YAG PI. They do that in the laser clinic. And so I refer to them who do the laser clinic. And sometimes it will be junior doctors. Mostly consultants won't do the work. And then sometimes they do as well. But that is another level of treating, because I said about 4 levels, and this is 4th level of optometry practice. And optometrists also work with consultants along with them in the clinic and manage difficult cases, post-op cases and things, depending on the interest. I mean, I don't work with them much, but my interest is more about other things. So I work in different clinic. And suppose if a patient has, say, a poor compliance and they don't do the drops and they don't know how to put the drops, or if they want a pressure measurement, they don't need to see any optometrist or ophthalmologist. They can see the nurse and they can measure things and measure the pressure and advise them to say how to manage. And this is quite useful, and we don't have that in India, I believe. So I find it very useful because I don't want to spend my time explaining to patient about drop installation, but it makes a huge difference, because if they don't know how to put the drops, I think the purpose of managing glaucoma is defeated. So community nurse help them. I mean, not community, in the hospital nurse as well. They try to help those people, and they are benefited by that. And I also do a community glaucoma clinic. This is more to do with, like, it's not in the hospital, but it's a part of hospital in the community, where I manage patients, seeing them, prescribing drugs. Same thing what I do in a regular glaucoma clinic in hospital, I do it in the community where there is a setup for the hospital. This helps the patients to feel comfortable to come for the appointment and not miss the appointment. So there are various options. In fact, we are starting a new scheme where low risk glaucoma patient, ocular hypertension and glaucoma suspects or very early glaucoma can be seen in the community by the community optometrist, which is like we would have defined what kind of patients are suitable for that, and refer those patients to specially trained optometrists who spend more time with them than what they do in hospital. So this is called PEC scheme, primary eye care glaucoma scheme, where the people in community manage them, and they send report every year or every 6 months when they see the patient, and we check and make sure that it's fine. And if they find the pressure is going up or something, they get advice from us. And we say maybe we will ask the GP to say prescribe this medicine or something, again checked by them. If it's a little bit complex, then they come back to us. So the optometrist role is quite at a different level between community and the hospital optometry. If you take the same thing in macula problems, some of the macula problems are stable and they don't need to see consultant or optometrist. They'll be seen in a EMAC clinic, which is a electronic macula clinic, where the technician will take the picture and send it to optometrist, and they'll grade them and say it's fine or not. And then the patient, if they are stable, at some point they'll be registered. They won't be seeing the clinician at all. So by doing this, I think we solve the waiting list, and we take more responsibility. And it's more enjoyable as well, because it's a different level of practice, and how we manage things are very different. So the idea of primary and secondary care partnership is basically to getting the right patient seen by right professional in the right settings. So it's all like one after another. Like the patient, if they're going and seeing a consultant, they must have really some problem or some issue. So in that way, optometry is practiced at different levels, and consultant will be the final goalkeeper to decide what to do for the patient. But in a way that we communicate as well. If there is a doubt, I won't just send the patient. I'll go and talk to the consultant saying, what do you think about this case, whether they need to be referred to you, and they will give advice. And same way, the optometrist in the community will contact me and ask questions. And the community optometrist who is not specialist in glaucoma, they'll ask the person who is a glaucoma specialist or to us. So it's like a very interactive way of practicing optometry. So which helps in innovative way of solving things, and economically it's better. And patient center contacted eye care model, which is very important. And that's what we do in Manchester. And these schemes are not available in many places, and we are trying to innovate more things. And probably in few years' time, we will generate more of these things, which will make the hospital waiting list much better. So that's the whole idea. And helping with communication between primary care and which I explained. I think it's very important to have the communication, because we all need to know what's happening in different places. So that generally happens. So it helps to people develop their skill and practice. And if you see, all these instruments are used not just in secondary care, in primary care as well, they use most of it, except gonial, which they don't use very much, which they alternatively they can use Van Herrick and Redmond-Smith grading technique. And all this helps us to solve problems. So I haven't focused on other clinics, but similar to this, we do macula clinic or cataract clinic. Everything has different steps that we manage. So I think that's the main thing I want to tell, but more to you to ask questions so that I can explain further. I think that's how much I can explain in the given time.
No, it's actually been wonderful listening to you. It's nice to know how evolved optometry practice as a whole is to what we are doing here. And I think with registration here as well coming into play, it's very important people understand the responsibility that comes with all the rights that we're fighting for. So there have been, I mean, most of the questions I think Gopi had forwarded to you, and those have been almost covered, but there are just a few questions which have popped up. So how important is maintaining a logbook of what you do at whatever stage of practice?
I think it's very, very important, Sharanya. I think if you don't have a logbook, you don't know what you're doing, and you have to defend. I think it's a good practice, and it also gives you some understanding what you're doing and referring yourself, saying, I have done this, and think about what you have done. And I don't know how much of work they do. It depends on that. If they haven't seen the fundus for a particular patient, then they have to think about, okay, I've seen a patient with retinal issue or myopic degeneration, and I have to see in this many patients to feel comfortable, whether it's a retinal detachment or retinal schisis, or what's the OCT telling, what you are thinking. All this matters, and maintaining a logbook will give help. And to be honest, I maintain a logbook now. It's not for every patient. The outliers, I try to put them in a separate Excel spreadsheet after seeing the patient. So I don't think you have a choice when you see patients and you want to learn. And it's helpful for you to have a collection as well. Like if you have a OCT with the particular problem, if you want to explain to Kali, you won't remember that I saw this patient this day, but if you have the reference, you can go back and show someone. So it's more learning as well. So I feel logbook is important. You can't maintain everything, but it's a good practice to start with and help yourself mainly.
So that brings me to the other question which popped up. Retinoscopy, slit lamp and fundus evaluations. Do you have to do it in all your cases? I guess they're talking about community optometry.
Okay. Community optometrists, definitely they have to do. I think the thing is, they come for site test.
Routine site test.
Site test, which is basically testing everything, which is like, we call it MOT. Like for a car, you test everything and say if it's fine every year. Same thing, it happens for a person who's checking whether the eyes are fine. So they can't do things without using slit lamp and fundus examination. But there are patients who come after for a secondary test, for a pressure recheck or visual field. Then you don't need to do all that. But generally, yes, you do everything for every patient for who comes for size. It's mandatory.
Yeah. Irene, hi. Do you want to unmute and ask the question, or do you want me to ask the question? You can unmute. It's a small group. Irene's here with us.
Okay.
So there's a question like, who does specialty contact lenses?
It's all done in hospital. I think hospital manage contact lens patients. I think there are a few optometrists in the community. They do specialist contact lens, but it depends on the place, and they don't need to go to those optometrists if the service is available in the hospital. And it's question of whether it's funded or not. Because in the past, there used to be places, I mean, even now, many places where the contact lens service is not available. One of the purpose of me going and learning contact lens in Birmingham, because it's one of the specialty contact lens place in the country, is to start something in a place where there is no contact lens service in the hospital. It didn't happen, but there are places where optometrists do specialty contact lens and they charge a lot. So NHS don't like that idea, but we do. I mean, in NHS we do. I think to tell few things, I think we try to manage cost as well. We go for local people who do manufacture contact lens, and that way cost reduces as well.
Yeah. So just to put this in perspective, the healthcare system in UK is what is called the National Health Scheme. And the government takes care of payments to the hospitals or to the community optometrists based on what we pay in as a national insurance payment that we do on a routine basis. So that's how it works there, unlike in India, where it's all private mostly. Except when you go, of course, to the government hospitals. So Dave Kani has a question. When a patient walks into the optometry clinic with family history of glaucoma or diagnosed as a glaucoma suspect, is it the same protocol which is followed in all the clinics, or can the optometrist decide what they want to do?
It's a good question, because it's knowing glaucoma and trying to help people. And I have seen people who are, I would say, senior optometrists who've been there for many years and who won't use OCT or special devices to take measurements. Those practices sometimes refer people very late. And we have seen them not referring at the right time when people develop glaucoma. But with modern technology and multiples, they all have OCT and better way of measuring. And they decide based on what they think is suitable for hospital optometry. To be honest, in the last 3-4 years, especially after COVID, we discharge more glaucoma suspect cases. We don't see them much. We want to discharge them because the optometrists in the community are capable of managing them with the level of equipments they have. They can monitor them. And I did a study, this is 15-20 years ago, about how people progress in glaucoma over their lifetime. I analyzed 100 patients, but the sources from 30,000 patients. I picked a stratified group, and we checked how people change, how glaucoma progress. And people with glaucoma suspect who are monitored correctly and referred and things, they don't develop glaucoma for 100 years or something. Like they don't vision threatening glaucoma, they don't develop it for 100 years. So they are very low risk cases. So they need to understand, suppose a person is having early normal tension glaucoma, that there are other answers as well, like looking after their lifestyle and whether the B12 is less, all those things. So it depends on the optometrist how much they know, and they don't refer quickly. They refer to girls optometrists because they get a second opinion there before seeing us.
So it's important that we understand nutrition as well as style and everything.
I think it makes a huge difference because one of the key is to how you communicate with them, and it's not important to know various things. It's important to tell them. My patients love me because I try to help them with the diet and everything.
The holistic.
Yeah, the holistic thing is very, very helpful.
I think I asked you that question very selfishly because students in general, biochemistry, nutrition are subjects which are given a stepmotherly treatment. And I believe that, you have to understand how the physiology, the biochemistry, and the nutrition works to be able to actually talk to your patient holistically, like you say. So, I absolutely agree with what you said. There's one, Kani was asking, how can we reports from other clinic? Kani, we are supposed to send the reports. We have a permission from the patient when they come to our clinic in the community to be able to transfer their reports to the hospital clinic. So I think that still holds, doesn't it, Subash?
I mean, we have moved one step ahead as well. I think we have got, I mean, the reports are sent electronically now, and it's not paper report, it's all electronically sent. And if you go to the LOC website, there are softwares which is created, which links between hospital and community optometrists, through which they send the reports. And also, patient has access for reports these days because it's an American-based system, and they can see using an app and see what we have done as well. So
it's kind of like the DigiLocker, the system, and the passport, health passport that they're talking about here as well.
Sure. Yeah, I think it gives a lot of information to people, and we can, I mean, still it's developing, but we can give feedback to them and monitor them differently as well. So that's all happening.
So there's another question which says, Ireland optometry practice, is it the same as in UK?
I don't know much about Ireland. I think if it's Northern Ireland, it's the same thing as UK because it's part of UK.
Part of UK.
But Ireland is, I mean, if you just say Ireland, then the practice is very different. I think they do diploma. I don't know whether they do degree, and no one has explored it.
Yeah, I would probably suggest looking up the websites for the Irish Optical Association and then figure it out from there.
I'm just curious to know why they asked that question, because what interest they have to go and practice in Ireland? Because first of all, you need to understand what they're talking, which is not easy.
Yeah, I know. So much, don't they?
Yeah.
So there's a question here, which is a couple of questions. I'm going to combine both of them. One which asked was 2 years of practice in the country of qualification. Would you suggest a hospital, or would you suggest an optical outlet, or a hospital which allows you to go into the optical outlet? And how do you upgrade the clinical practice, in an available facility? Maybe what are the alternative ideas to upskilling in different specialty in optometry roles?
I think combined will be an answer, because when I worked in Shankar Nethralaya. I won't have any dispensing knowledge as much as someone who's practicing in the front end in primary care. And when you come here, it's not easy to get into hospital optometry. It's quite challenging. So the point is you have to make sure that you learn the dispensing. That's one of the key. And it's more about talking to patient as well. So I think it gives a different perspective. And when you do a role with ophthalmologist, you miss some aspects. So I would say both if possible, because it gives you the knowledge of ocular conditions and managing them, and you get a support of seeing something, a fundus, and examining using slit lamp. Those things need to be learned as well. So it's a combination of things that you'll be exposed when you come here. So I would say both.
Yeah, absolutely. I would agree entirely with you, because when I moved to the UK, the first job that I had, I think the biggest difficulty I had was the dispensing aspect of it. But I mean, because I was in the contact lens clinic here, it was just a matter of extrapolation. So I guess I could sort of fit in, but I would really, really suggest learning dispensing if you want to be there. So the next question is, it's a very interesting one on glasses and contact lens prescription. There is a validity which is mentioned. So, when prescribing for UK, Devkani says she makes sure that she puts the validity date. So how important is this? And does the optician in the shop make sure they have updated prescription, or can they just refill, even if this is not mentioned? Kani, Sukumar, Subash, I'm just going to add just this one thing. I remember when I was in practice there, I didn't realize the value of the validity, but there was actually a case which happened over there where they had refilled the prescription and the patient could claim the motoring accident was because of a refill rather than the current prescription. So
very true, Sharanya. I think if it's written in the Optical Act and if this is what you need to do, I think that's why I say it's very responsible job and you can't make simple mistake. And that is very good example that how important it is to write the date. And one other thing I notice is in many hospitals in India, they don't write the vision.
They don't write.
They say this is the prescription, but not the vision. And those things need to change. If you're having a practice, I would say write the vision, because that's what you need to tell the patient how much vision you have. I think validity date, as you explained, it's mandatory. If you go with a prescription somewhere, they won't make the classes unless you have valid.
Because so, Kani, that's basically in the SOP, basic rule of practice. You have to look at the validity date. And if it is less than a month, we generally don't refill. We ask them to have another site test and then go ahead with the refilling. One last question before I wrap up, unless we get any further questions. This question was recommendation letters from previous employers or institutions. How important is it for us to maintain a good working relationship with all the previous places that we've been at? I think this is from the talk that you said, feedback from employers and patients and things like that. I think it's related to that.
I think it's important, Shalini. I think you're convincing someone to get a pre-reg here. If that is the stage you're asking for, they need to feel comfortable. And they don't know you and they don't know how good you are. It's all about what you show in paper and how you talk and convince them. And that aspect, I think if you can convince them, you can easily go and be a pre-reg. But if you can't convince them, you end up being in a situation where you have to do courses in the university. And some people find it very hard, because I've seen few people saying, I went for the interview and they say, do this list of things, go and learn optometry again, 1 year of optometry, which is expensive. And if you count how much it cost, I think it's about 20 grand or something to do optometry, an international fee. And if it's national fee, it's 9 grand, but if international fee, it's 25 grand, which is like 25 lakhs you have to pay and learn. So it's a lot of money. So I would be very, very careful and try to do everything possible to convince the person that you are good and you already prepared for being an optometrist in UK.
Yeah, I guess the bottom line is learn as much as you can, practice as much as you can, maintain a logbook as much as you can. Don't burn bridges, because you're going to go back to your previous employers for all the letters of recommendation and referrals, I guess. And you know, just practice and don't learn bad shortcuts.
True, very true, Sharon. Good summary.
So just to quickly summarize what you said with regards to registration, I think you said 2 years experience in the country of qualification, an IELTS exam, verification of transcripts, registration as a pre-reg, the pre-reg year where they undergo 3 stages of evaluation, where they evaluate the standard of your skills, and they also look at feedback from patient and previous employers for your interview before you register as a pre-reg.
True. Yeah.
So I think I've just kind of wrapped it up as a little bit.
I think that's a very good summary, Sharani. I think it's more about you identify yourself a person who is in primary care. You need to be seen as a good person who can provide the good care. And that is the primary thing. If you don't know something, that doesn't matter. If you don't do something which is supposed to be important, they care for that more. So and you need to know the right thing, right way of saying, and even asking, saying, I don't know this, what's the answer? That is appreciated. And you will quickly learn actually that way, rather than not learning enough and thinking that you are okay. And hesitation makes a big difference. And
absolutely.
That's the key.
I think humility and learning all the way along. And I really liked what you said. You don't have a choice. If you want to learn, you have to do maintaining the logbooks and learning new things. I really like that statement. It's brilliant.
Thanks, Sharni. I think it's important. They don't have a choice in a way.
I know. So I'm getting a lot of congratulatory messages for you, Subash. Great info, great talk. A lot of really good congratulatory messages here. So thank you so much for spending your weekend, almost a couple of hours of your weekend with us. I think Gopi and I and our team here, Saravanan, Shiva, and all of us had this concept that none of us knew what to do immediately after optometry, and we need to kind of get people empowered. If we want optometry to grow as as a course of choice, if I may say, as a career choice, then we need to empower people with the knowledge of what they can do immediately after and how they can progress. It's not just doing a routine site test and finishing it at that. So this talk has been really brilliant because it's actually given us a clear idea as to how much you can do in the community, how much you can do in the sort of hospital environment. Interestingly, how you can upgrade yourself at every level and move on to the next if you're really keen on doing that. So thank you so much for spending your time with us. And a lot of thank you messages popping up on our screen to say thank you to you for being here and spending this time with us. So on behalf of all of them there and Gopi and me, thank you so much. Gopi,
it's great pleasure, Sharanya. I think it was nice to be able to tell these things to people. One thing I would say is learning is never ends, and you always
absolutely
get opportunity to learn. And if people are interested to do short, simple courses and things, many universities here provide that as well.
Yeah.
Just to learn diabetic retinopathy related issue, or if you want to learn glaucoma, some needs the person to come here, but there are online thing as well. So they have to think about if they are interested in something. So thanks, Sharanya, for inviting, and it was good to.
No, actually, I think we have to say a big thanks because we asked and you said yes right away. So it's so brilliant that you could actually spend this time with us, and we really appreciate it. Gopi?
Pleasure, Sharanya.
Yeah. Thank you, Dr. Subash, for the wonderful bringing out all the aspects of how to practice as an optometrist in a community, as well as specialize in various fields in eye care, especially at UK. And to the participants, I think we will have series of lectures like this in a subsequent couple of weeks, and we believe we inspire to some extent and take away key major points from these sessions. And we one more information is that the sessions are going to be available in YouTube as well. Maybe as soon as we post it, we will communicate through email with the links. And thank you for listening, and thank you very much, everybody.
That's fantastic and great initiative, I should say. And I think it will be very helpful for people. And you're doing many every month, is it one?
Every month.
I think that's brilliant. And I think that's one step forward for optometry to think what they can do. I'm happy that I'm part of it.
Thank you so much. We are going to keep calling on you, by the way.
Anytime, Sharon.
Yeah. Thank you.
Thank you.
Okay.
Thank you.
Bye.
Bye.